in the industry that we are in, continuity of care for the people that we support is so important. And you get that by having a more stabilised workforce, and it gives a better experience and a safer experience for the people that we support. So it is always, a front of mind conversation.
So the other effect of not having the right amount of people is the cost of treating those patients becomes more expensive. You become less profitable as a business. You can invest less money in what you want to invest it in. So there's that kind of business element as well. It means without the right amount of staff, you can't undertake as many procedures.
Hi, I'm Johnny Campbell, CEO and co-founder of Social Talent, and welcome to another episode of Hiring Excellence. So today I've got two fabulous guests joining us to discuss recruiting in the UK healthcare market. It's a hot sector around the world. Healthcare recruiting seems to just increase unabated pretty much everywhere in the world because, hey, demographically, most of us are getting older and more we're seeing a need for healthcare, and that's driving massive pressure into healthcare hiring. So we're going to talk today about the UK healthcare recruiting market. And joining me are two great folks who can give great insights into that. So we've got Emma Neary from the Priory Group. Emma is the TA director in Priory Group, and she's going to tell us a little bit about Priory Group. You may have heard that name before, and she'll explain that to you if you have. And also Chris Bleakley, who's the director of resourcing as well over in Spire Healthcare. And you may not know Spire, but you might know them from a previous name. But between Emma and Chris, they do a heck of a lot of hiring. That's very important, and a bunch of different roles. They're going to walk through what they are. And I think both of them you'll see today are going to give you a great perspective on healthcare recruiting in the UK. Emma, I'll start with you. You're very welcome to the show. I wonder maybe if you wouldn't mind introducing yourself and explaining a little bit about who the Priory Group are, particularly to our international audience outside the UK, and maybe a little bit of context as to your own career and how you ended up here.
Okay, lovely. Thank you. Thank you for having me today. So I work for Priory. We provide mental health, addiction and adult social care services across the UK. We've got about 270 sites, employ about 13,000 colleagues. Pretty big organisation. We provide private care, but also provide services on behalf of the NHS as well. I've been here for 3 years now, into a newly created role. It was a big change for me. Prior to that, I was in more technology-focused businesses and retail, working for very.co.uk and Money Supermarket. So it's been a very steep learning curve, but it's given me lots of challenges working in healthcare.
Awesome. And Chris, over to you. Maybe you might give some context to Spire Healthcare. You've been a guest on the show before, but in case our audience has missed that brilliant episode.
Well, thanks, Johnny. Nice to see you again. So yeah, I'm the director of resourcing at Spire Healthcare. We are a hospital group. So we've got about 38 hospitals around the UK, and people would have known or may have known that Spire Healthcare was formed by us buying out Bupa hospitals. So a lot of what were Bupa hospitals at Spire Healthcare. So it's interesting. That's a brand that quite often people know better. We've also got a series of clinics. We've got about 50 clinics across the UK. So we're moving more into primary healthcare as well as having the hospital group. A bit like Emma, our business comes from 2-3 different forms. So there's private healthcare itself, whether it's insured or direct, but also supporting the NHS. We do more hips and knees than anybody else in the UK. So we've got contracts with the NHS to help deliver those to patients. And then a bit like Emma, interestingly, my background is not healthcare. I've been here now I keep doing it in months, but I've got to stop doing that because it's nearly 2 years now, or it will be when I get back from my holidays in a couple of weeks. And my background was financial services broadly, and back in the day, RPO. So again, healthcare for me, like Emma, quite a steep learning curve, both in terms of the way it operates and in terms of the skill sets that you're recruiting for.
So Chris, I'm going to stay with you maybe to give our audience some context as to the macro environment. Are the factors affecting healthcare recruiting in the UK? And let's start with the NHS and its role, because is it fair to say that the NHS plays perhaps an oversized role in the entire healthcare market in the UK and therefore the recruiting market?
Yeah, it's a kind of, and it's a massive yardstick for everything we do. So if you think about the roles that we recruit for within the hospital group in particular and elsewhere, a lot of those roles exist obviously within the NHS. And the NHS is a yardstick for everything from pay to conditions to training to perception of what it's like to work there. And in all honesty, when the NHS, when those perceptions are high and when pay is good and conditions are good, people want to work with the NHS. Often, when the NHS starts to be a more challenging place to work, sometimes we find more people coming over to the private sector. Not always, that's not always the main driver. There's all sorts of other drivers. You know, we're a great place to work, we pay well, conditions are good, development's good for people. But the NHS does remain that major yardstick. What's going to be interesting to see is what is going to happen as we move into the next few years. So there's a lot more talk about the kind of partnership between the NHS and between private hospital groups to try and shift the waiting list. So we're clearly a big part of that. We've got contracts with the NHS. Will that end up merging the sort of public-private sector a little bit more? I don't know. But culturally, you will get people who are very specifically families of nurses, for example, who work specifically in the NHS and aren't necessarily considering a career in the private sector. But it'll be interesting to see what happens in terms of pay and conditions in particular when they go up, which I think they will over the next few years. What will that mean in terms of our ability to retain staff and attract new staff? And I think personally, it's going to get more challenging.
Emma, is that how it's played out for you? Is that how you see it as well, in terms of even if you're not necessarily operating as much in that kind of public area, that there's just, because it's, it's one sector, what the NHS does affects pretty much everybody?
Yeah, I mean, absolutely, it does. I think there's kind of the wider context at the moment as well. So, thinking about the financial constraints that the NHS is operating in, thinking about the launch of the government's 10-year health plan, Fit for the Future, back in July. Actually, there's quite some optimism in there as well. So kind of touching on Chris's point around actually how providers can work together, it will undoubtedly kind of mean that our services that we provide and the shape of our organisation will need to evolve. But I think we'll have lots of opportunities with that at the same time. So for me, it's all about sort of agility, being adaptable going forward.
What about supply constraints? Or, like, I imagine the healthcare sector in the UK, similar to Ireland, similar to the US, has relied upon net immigration to fill those roles. Are either of you, what did you comment on trends you see there in terms of, is that reliance dropping, increasing, steady, and how do you see it changing?
Well, I think that we know that we've got a shortage of healthcare professionals from a macro perspective. But interestingly, what's happened for us more recently is we used to do a lot more hiring of international nurses. So nurses we were bringing in on visa sponsorship from abroad, largely speaking from places like the Philippines and then South India and probably West Africa. There was a need for us to do that to make sure we had the right number of nurses across the hospital group. That's dropped off. Right? So we've not had that need in the last 12 to 18 months. So there would have been times where we've been bringing in large numbers of overseas nurses, but we're not doing that right now. Now, if you look at what I would describe as our nursing gap, so how many nurses do we need versus how many we actually got, it's probably the smallest ever. So that nursing gap is probably 3 or 4% maybe, which is really low. Now, I think part of that is because we've had a lot less attrition. I mean, there are all sorts of reasons why people aren't changing jobs right now. The world is not a stable place, so you kind of stay where you are. But also, we've been an increasingly good place to work, I'd like to think as well. So that's a positive sign. But I think it'll come back again. I think we will need to go back to that market because we're only going to need more nurses and more medical and clinical professionals, not less. And that market is finite because I don't think we are training and developing enough of our own in the UK. And we'll end up having to support more net importers like India. The Indian government's got a policy at the moment to make sure it's a net exporter of nurses, which will then return money back to India. Right. So rather than that, they're having a shortage of nurses in India, they're exporting that skill set, bringing money back in. I think we'll need to think more about what our longer term strategy is in that space over the next few years.
Emma, are you hiring similar skill sets, or would there be differences? And what is the effect on that, immigration going up, down, or that demand for you?
Yeah, I mean, it's been a really interesting one. So when I joined Priory, and I can really only talk about the last 3 years, we were still recruiting a lot of our healthcare assistants and support workers from overseas at that point in time. We put a stop on that pretty quickly. We still had gaps, and that's where our partnership with our RPO partner CLO comes into play. But we did continue to recruit in terms of the nurse hiring space. But similar to Chris, we just haven't needed that same demand. And it's hard to pinpoint exactly why. I think it's just a combination of lots of different factors. Internally, we've changed our recruiting model. We have colleagues who now focus purely on nurse hiring. So the RPO has allowed us to have an internal talent attraction team, which we didn't have that focus previously. But, like Chris, we've done a lot in terms of retention, looking at development, growing our own nurse apprenticeships, really kind of showing that career pathway, care as a career from healthcare assistant support worker through to the apprenticeship and so forth.
Yeah, I think that's Emma's point there about growing our own is increasingly important, because what we can't do is become reliant on net exporters of nurses from elsewhere. And I think where the future lies, I hope, is in much more collaboration between the NHS and the private sector in growing our own, right? Because we can all run apprenticeship programs at the same time to increase the total number of healthcare workers, whatever the skill set. And there are some, there's shortages across the board, but there's some more acute shortages in some areas in some areas more than others. Because the thing I'd say is, what is the impact we're going to have as a result of, I think, people who are currently professional agency workers coming back into the permanent market? That could be a bit of a boost. If you look at, I think I've got the number right, Wes Streeting said to most NHS trusts, reduce your agency usage by 30%. We are using a lot less agency workers than we have done in the past. I mean, a lot less. I know that's true of organizations that are my competitors. So say Circle or Ramsey, everybody's using a lot less agency workers. I mean, the knock-on effect in our industry is interesting. Somebody gave me a stat a couple of days ago, said that the number of people in the recruitment industry now versus pre-pandemic has reduced by something like 40+%. That's higher in agencies that supply healthcare workers. I can think of 2 or 3 agency suppliers of ours who've gone bust in the last 6 months, because the supply, the flow of, and the need for agency workers in the volume that existed a year ago has reduced. And if you're a small agency and you've relied on one hospital or one client or whatever it might be, you're at risk. And I think, but the point to your question, Johnny, is what will that mean where we've had people who are professional agency workers? In other words, that's what they do when there isn't the agency work. What's that going to mean about the skill sets that are more available on a permanent basis?
Do you see the same, Emma, in terms of a reduction in agency reliance, for example, driving more retention, less turnover in the business?
Hugely, yes. It's interesting to kind of hear Chris talking about the same things that we're experiencing. It is significant. If I kind of look at the figures and think where we were back at the end of 2022 when I joined to where we are today, it's like night and day. So we're in a much, much stronger position than we were. And everything's going in the right direction, but you're going to hit that plateau at some point, and you've got to be prepared for what comes next and how you get ready to rebuild.
I have a question for you, just in terms of, sorry, Chris, in terms of just for anyone listening who doesn't do healthcare recruiting, I wanted to bring up a point to just make sure it's relevant to you, because we had Kathy Hennessy from Advent Health on the podcast last week, and she's US based, and Advent hire about 40,000 people a year. And Kathy brought up the point. She said, when you are delayed hiring, or you can't fill a vacancy in, let's say professional corporate environment, maybe the engineering team is short 2 people, maybe whatever. She goes, in healthcare, someone has to do that nursing role. And so there's a knock-on cost of overtime. Typically, if you don't have vacancies filled fast or filled at all, then they're not left vacant. Somebody's being paid overtime, and the expense is massive. Is that something that you look at, Emma, in terms of not just traditional TA metrics where let's just go faster because it's nice to go faster, but there's a real cost in taking too long or having those vacancies? Would you see that And would you kind of monitor that, or look at that as a kind of win for TA to reduce that?
We do. It's something that we talk about every day. It's very much, front of mind, but not least because, yes, there's a commercial impact in there and we want to be able to invest in the right places. But also, in the industry that we are in, continuity of care for the people that we support is so important. And you get that by having a more stabilized workforce, and it gives a better experience and a safer experience for the people that we support. So it is always, a front of mind conversation, and we will always track, what have the trends been within each of the sites over the last 3 months? What do we think's coming up? What's causing that? Do we need to be hiring more? Because of course there are reasons, valid reasons, where you do need that the agency support in there. But overall, we are definitely working to keep that number in that lower level that we've now reached.
Yeah, I think, and bear in mind, the other thing, Johnny, is that we've got 3 forms of resource in many ways from a healthcare perspective. We've got our permanent workforce, we've got our bank workforce, and we've got our agency workforce. And in many ways, a bank workforce is sort of like a semi-permanent workforce. Lots of bank workers work fairly regular shifts. So, little things like Emma says, continuity is important. A bank worker knows the shape of a hospital, knows where things are, knows who to go and ask about stuff, understands the policies from the off, because they've been working those shifts or some shifts on an ad hoc basis over a number of years. There is a lot more space, I think, to grow that group of although they're flexible, they're also people who are known and provide that continuity. The one other thing I would say that's different in terms of different sorts of healthcare is clearly there's the continuity and the importance of care of your patients. The business element or the commercial element also comes into play, because if you think about a hospital if you think about an NHS hospital, right, it can't choose when stuff's happening. People are getting sick or ill or injured, and therefore they are going into hospital, and there are various factors that might contribute to that. In the private sector, you're deciding when you have your knee done, right? It's not suddenly by accident that it needs to be done on. Now, clearly, one of the advantages is that in the private sector, stuff happens quicker, right? Having said that, it still happens in an organized way. So the other effect of not having the right amount of people is the cost of treating those patients becomes more expensive. You become less profitable as a business. You can invest less money in what you want to invest it in. So there's that kind of business element as well. It means without the right amount of staff, you can't undertake as many procedures, and that has a commercial knock on.
Again, there's a lot more complexity to healthcare recruiting than a lot of traditional recruiting in other sectors, right? Is kind of what I'm hearing. And Emma, earlier on you mentioned, for example, that you work with Cielo. Cielo are good customer social talents. We've had several of the Cielo team on the podcast in the past as well. And I know both of you have had different journeys with different support partners, but tell us, Emma, about the role Cielo has played in helping your recruiting strategy and why that's been integral over the last few years. And maybe Chris, you could give us your counter story on that as well.
Yeah, sure. No problem. So at Priory, we have a decentralized model, small talent acquisition team, and then each site ultimately being accountable for their own recruitment. And when I joined, as I mentioned, it was a new role. The talent acquisition team had a team that reported over to one head of over here. Another team reported to another head of HR over here. But we were definitely running in that volume hiring space at quite high vacancy levels. We also needed to work very much on our brand, unify our team. And there were so many different aspects going on. I kind of thought, well, how am I going to move this forward? How do I build a team and a function that's going to be more kind of future proof and fit for what may be coming? And ultimately RPO was the route that I settled on, because it allowed us to address the immediate challenge by outsourcing the volume hiring side of things for healthcare assistants and support workers. And then it also allowed us, in tandem to that, for our talent acquisition partners to move across to this newly established team, so our talent attraction function, which is very much focused on direct sourcing for clinical and specialist roles, and to focus on the brand building side of things as well. So we've done some work this year and last year on personas for our nurse hiring and therapy hiring, for example. And the other thing that I think that Cielo have brought to the table, as well as that real kind of trusted partnership, is we get to try different technology with them as well. So within the talent acquisition team, we were, things have changed as of a few weeks ago, but we were quite restricted with the technology that we had in place. And we've been able to try different ways of working with CLO and really try and build up a blueprint for how we will hire in the future when we take that back. So it's allowed us to address an immediate need whilst moving our function forward. And if we didn't have that breathing space, I think we would have just been trying to spin too many plates and things would have started dropping. So it's just the right time for us.
Yeah, I know Seattle are big users of Paradox, for example, and embrace
Yes.
their AI technology. We had Hudson RPO on the podcast a few months ago talking about how they've literally gone out with a strategy to work with customers who are finding it difficult to get approval for AI tools, but they can use them, and so therefore you can use them at arm's length, so to speak, with your provider. But Chris, before you came in, there was an RPO provider in Spire, and the organization took the decision to go a different direction to bring more of that in house. Can you maybe explain some of that, or maybe I'm not describing that correctly?
No, it's good. Look, first thing I'd say is I think I don't think it's necessarily an either or. I've worked for RPOs. I've had RPOs as my solution. I've had 2 RPOs as my solution, or an MSP, or I've had a mixture of both. And I think it's just what's right for that organization at that time. So, I worked at Nationwide. I did the same job at Nationwide Building Society before I was here. And we had an in-house team, but we outsourced big chunks of work. Some of that was to AMS. Some of that was to Impel. I've worked for AMS. I've set RPOs up, sold them and implemented them, worked to them. So I'm a big believer of them as a solution. And I think it's less about, although this sounds like theory, it's also what happened in our particular case. And this had started to happen, to be fair, the decision had already been made before I arrived. But I think it's more about 3 things, right? I think, which is the contract, or have you got a contract that's set up for success, right? Is the contract driving out the right behaviors of the provider and of whatever in-house team you've got left? And if it isn't, you've got a problem. If it is, it's great. Is it a strategic partnership? Genuinely, it's white labeled, because I always used to white labeling RPO solutions so they were part of one team. And is the leadership on both sides, as in for the RPO and in-house, there? If those 3 things are in place, right, at the time, it's going to be a success. If those 3 things are not, then you maybe need to change provider or change the solution. And that's kind of what we did, because I don't think those 3 things were working. That's why the decision was made. Now, the interesting thing is, most of the people that work for the RPO provider now work on the in-house team, right? So it's the same people. And it wasn't working, and now it's working brilliantly, right? So it's not the people. You've met a bunch of them, Johnny. We've got some brilliant recruiters. They're very talented people. They're incredibly driven. But if the contract and the leadership and the way that they are partnering or partnered with is not working, it doesn't work. So that's the only reason, really, that we've got an in-house model. And Emma's probably got exactly the same need as I have, which is, can you demonstrate quality of hire? Can you demonstrate value for money? In other words, cost per hire. And can you demonstrate some form of added additional benefits, like a strategic long-term view, strategic workforce planning, development of the brand? And if all those things are true, then you're doing the right thing. I think it's important to think about an in-house team can be pretty much like an outsourced team. And we're all direct sourcing. We had less than 1% recruitment agency usage across 3,700 hires. So it's tiny agency, and we're using the same tools that you would expect to use from an outsourced model. But without wanting to sound too cliched, it genuinely is horses for courses. Emma's got the right model. I've got the right model, because we need to do things, but we're getting the same outcomes, I think, by the sounds of things.
Would that ring true to you, Emma, those criteria? It sounds like you do have a good partner that's working really well with you, and it's been a massive success. Would you agree with those criteria, that they're the kind of things, the fundamentals to have in place, and it isn't an either or situation?
Yeah, completely. Look, it could have gone horribly wrong. That would have been very difficult. We spent a long time going through the selection process of who we were going to work with. And I think, the RPO that we're with, they just stood out from the get-go in terms of that level of partnership, consultation. We're in this together, problem solving. I mean, you have to learn each other's language as well. So even when you're setting the contract up, what do you mean by a hire? Is a hire when somebody's actually started? Is it an offer? That affects things massively. It sounds small, but so you have to invest the time. And you know, I think we took quite a while before we launched, but it was the right call to make. And then we continue to review and evolve. So I think, you know, all the things that Chris has said, you know, we've absolutely have had in place with this. And you're right in terms of the other things we need to be thinking about. We're talking about more around workforce planning. I mean, you can have a whole podcast on that, can't you? Because that's really quite challenging in healthcare. You know, we're talking about the brand, that there's lots of different elements that mesh together to make sure that whatever model you're delivering works effectively. It's just the circumstances that you're in at the time that will, you know, mean what is right for you.
And in either model, right, what you've got to make sure is that the team, whoever the team is, has got the skills and the leadership and so on, but also that they've got the right tools, right? And the tools that the team need are changing. You know, we're not throwing mud at the wall through job boards anymore. We're doing far more sophisticated stuff than that. And where you spend your money is becoming increasingly important, I think, because the whole way we attract candidates has shifted considerably in the last few years.
So Emma, 3 years into the job, thinking about the next challenges, with some challenges solved, you know, it's never over. You're never done. You never can just go off on holidays like Chris here and not worry. Not that that's
Tell me
happening.
your secret, Chris.
I'll get to you, Chris. Don't worry. What's next for you and the team, Emma? What are the next kind of mountains to climb, opportunities to go after that you think are there, that you're excited about, that you're putting effort, budget, time, effort into?
Yeah, great question. Quite timely because we're just looking at our plan for the next 5 years. So we've had a lot of thinking about what might be coming. I think, you know, when we're looking 2 to 3 years ahead, with the context that we spoke about kind of at the beginning of this conversation, there is so much happening. There is so much change. We don't quite know how it's going to impact us yet. So there is a lot of ambiguity. So somehow we need to be able to make sure that we are able to kind of preempt what's coming where we can, but also respond rapidly to things that might come a little bit left field at us. For us, one of the things that we're going to be spending a lot more time on at Priory is around our brand, around our EVP. People will, by and large, recognise the name Priory, but because we're so vast and we provide different services from acute psychiatric care through to supported living in the community, they will know us for an aspect, and they don't realise what that means in terms of the career that they could have with us. So even if we go to events, nurses might not, for example, realise what a career could be here versus the NHS, for example. So we need to get better at kind of really telling that story. The other thing that we definitely need to focus on, particularly because of the decentralised model, is focus on really evolving that culture of hiring and kind of upskilling our own team as well as the teams out at sites, to make sure that, you know, we're assessing in the right way, that we're giving the right experience. These are people that we're working with, that we're, you know, looking to join our organisation at the end of the day, and they have to have the right kind of behaviours to succeed in this role. It's a tough job. And then I guess the other thing that we're constantly thinking about is technology. So one of the things we've just done is implemented a new applicant tracking system. That's the first time in 10 years since we've had a new one at Priory. So it's early days. It launched at the start of July, but it's given us a really kind of solid grounding now to be able to think about, okay, what other changes do we need to do, and what things might we want to plug in.
I met a recruiting team during the week, and one of the recruiting leaders was telling me their system, you still can't search the CVs. You can't even do a control F on a PDF to find a word. So I'd say your team is overjoyed with the new ATS system.
There's a lot of smiling faces now. Yes.
Yeah, but
they won't last them. In a year they'll be back.
no,
honeymoon period.
Chris, same question to you.
Yeah, I think that again, there'll be lots of similarities. I think one of them we've touched already is my favourite 3 words, which I get mocked for at work all the time, are strategic workforce planning. It is incredibly difficult to do in healthcare. We've already touched on it, so I won't go on about it. But if you think What about the international? What about the apprentices? Where does this dovetail in terms of what we need to do and when? So we've got people landing in the right place. And on top of that, we've just built out 3 patient support centres around the UK. That's a different sort of hiring. It's hiring into sort of kind of like a customer service environment. So we've got to think about how we focus on increased quality into those areas. So and do we need to hire into the most junior role and promote people through so there's a career path, and so they're being developed in the Spire way and they're treating our patients and customers in the right way. So there's a whole piece around strategic workforce planning, which I think is really hard to grasp, but I think we're getting a bit better at it. Flexible resource is very high on my list, and then sort of technology comes into this as well. So what do we do about our strategy around agency and around bank? I still think there is a lot of savings to be made by changing the mix of our flexible workforce, less agency or bank. Some big opportunities there over the next couple of years, where we're really going to make an effect or have an effect on the bottom line of the business, right? And this is where we're being strategic but operationally important at the same time as a function. We're trying to implement at the moment a digital bank. So rather than you having to look at your WhatsApp group of who might be available or peel off a sticky note off the wall, you can press a button on an app on your phone and you can get to all your bank workers in one go, and they can then accept shifts and you can pay them through that as well. So that's really exciting. And that'll really make it much easier for us to quickly get to bank workers rather than necessarily agency workers. And that's linking with some of the changes we're making with Oracle. We've got Oracle and we've got position management in place now, which means it'll be easier for us to understand how many of what job we need in what place. So it makes it easier for approvals and that kind of stuff. And I think the final, but I think brand is big, right? Brand's big for both of us, probably in a similar way, in that I think, the Priory to me is a well-known brand. Spire's like arguably the biggest private hospital group in the UK. But I bet if you ask the average person in the street whether they use Spire or then use Bupa, they'd go Bupa, right? And Bupa have like one hospital. So I think within the market, we've done a lot of work to position ourselves with the people who know the healthcare industry, but we employ chefs and IT people, and procurement people, and HR people, and porters, and so on and so forth. So there's work to be done in that kind of ironically, more work to be done in that kind of non-clinical space, and we're trying to find ways of tracking how well we're growing our brand is what I'm particularly interested in. So lots of exciting opportunities, I'd say, John.
Well, Emma, Chris, I can't thank you enough for joining us here today to have a great conversation. Differences, but I think you'd argue more similarities than maybe one would expect. And I think those of us listening from outside the healthcare sector are probably going to find 90%, 95% similarities in the hiring, but maybe an appreciation for the complexity that both of you have in terms of unique healthcare hiring in the UK. Appreciate you coming on, both of you. Appreciate our audience for listening. Thanks for joining us, Emma. Thanks for joining Chris. And thanks to you, the listener, for joining us this week on another episode of Hiring Excellence. We'll be back again next week with a new episode. Until then, take care.